Do you often find yourself feeling a little stuck in the past? Like you're constantly ruminating over and over again about everything that has gone wrong in your life, and you're feeling this deep sense of shame and guilt? If so, first of all, I want to say I'm sorry that's been happening to you. And number two, I think you're in the right place because in this video, I'll be talking about some therapy strategies that I use with patients to help reduce rumination and get someone feeling a little bit more hopeful about the present. Hi, if you're new here, my name is Parky. I'm a postdoctoral fellow in clinical psychology at Stanford University. I love talking about evidence-based mental health and also providing some therapy tips and tricks that people can use even outside of the therapy room, which is why I make these videos. So first of all, I want to define what rumination actually is and how is it different from other types of repetitive negative thinking. So the big difference between rumination and worry is that worry tends to be pretty future focused. So it's focused about things that a person is, well, worrying about in the future. Like for example, needing to make an appointment, worried that they might get sick and not be able to provide for their family in the future, or if their kids are going to go to the college of their dreams. All of these future focused types of repetitive negative thinking are usually more worry specific. On the other hand, rumination are people who are stuck in the past. So they're ruminating over the things that have not gone right in their life. Like for example, maybe not getting into the program of their dreams or not being able to do something for somebody and feeling a deep sense of shame and guilt. So worry is future focused, whereas rumination is more past focused. And while worries are more typically associated with anxiety disorders, rumination are a pretty hallmark feature in depressive disorders. And the reason why rumination is so depressogenic is because first of all, it's a pretty passive process. When we're ruminating, we're not particularly thinking about any problem solving, we're really just thinking about the same negative thing again and again. And typically, as I noted, the rumination content tends to be pretty depressive in nature. They're usually about things that we didn't do or that we failed or we feel like we didn't do a very good job on. So all those things reduce our sense of self-efficacy and really increase the chances for more depressive disorder to take hold. Okay, so now let's talk a little bit about some of the therapy skills that I personally found helpful with patients. And this first one might surprise you, but it's actually called distraction. And the reason why distraction can work is because it takes us away from the ruminative behavior, takes us away from the past, and brings us into the present moment with something a bit more enticing and engaging. So this could be anything, and some of my patients have found really helpful utility to things like watching a fun comedy movie, taking a walk, making themselves a nice hot cup of coffee or a tea, or taking a warm bath, smelling some scented candles. All of these strategies can be helpful for us, at least in the moment, to bring ourselves into the present moment, do something actually enjoyable, and get our minds off of rumination. And obviously, we don't want to overuse distraction. This can be particularly helpful in the short term, like maybe you're just needing to get out of your mind and into your life for a moment, then distraction can be super helpful. But for reducing rumination down the road and in the long term, we'll talk about some other strategies too. And a second practice that can be super helpful to reduce rumination is through a mindfulness practice. And the reason why mindfulness is so helpful is because its definition, which is to be intentionally aware of the present moment in a non-judgmental way, basically directly opposes the definition of repetitive negative thinking like rumination and worry, because rumination is past focused, worry is future focused, but in mindfulness, you're right here in the here and now, in the present moment. So when you are being mindful, you are inherently not ruminating. And one way that we can do that is by simply noticing our current experience just as it is in the moment. So when you're kind of thinking about these ruminative content, when you're noticing that these rumination are occurring, we can almost take sort of like an observer effect by just simply noticing them. And by what I mean by noticing them, there are a couple of ways that you can do that. One is to verbalize it and say, I'm noticing that I'm ruminating right now, by creating that psychological distance through kind of saying, this is what I'm doing, rather than the rumination is me. The verbalizing is one way. And the other way is through visualization. So visualizing that the thought and the ruminative content is around us, to be able to almost treat them like leaves on a stream or clouds in the sky, that you're kind of just noticing and being aware of what's happening in your environment, in this sort of like ruminative space. That also creates a sort of psychological distance between you and the thought. And one way that you can practice mindfulness even in this moment is to see if you can even notice the next thought that pops up in your mind, and see if you can visualize it like a cloud in the sky as it kind of just moves around in your vicinity, and you're just observing it, you're not engaging with it, you're not doing anything with it, you're simply allowing it to pass by. And there's even evidence in the scientific literature of the power of mindfulness in reducing depression risks. So one of the studies published in 2000 by Teasdale and colleagues actually compared mindfulness-based cognitive therapy with treatment as usual for patients who were recently successfully treated for their depression, and found that the risk of relapse and depression reoccurrence was actually much lower in the mindfulness group as compared to treatment as usual. And the reason why I think this is the case is because mindfulness helps reduce the power that thoughts have over our emotions and over our well-being by creating the psychological distance between you and the thought, so that the thought doesn't feel as fused to you. And when it doesn't feel as fused to you, by creating the sense of distance through visualizing, through verbalizing, all of that helps to reduce the intensity and salience and power that these repetitive negative thoughts have over our well-being. And that's awesome. And another way that I find helpful for reducing rumination is to allow ourselves to process and grieve the emotions that are associated with the situations. When I think about rumination, I almost think of us feeling really stuck in the moment, like we're constantly thinking and replaying this event over and over in our mind, and we're not allowing ourselves to be able to let go of that moment. And one thing that can be helpful is to be able to sit and grieve what happened to us and allow the emotions to just be there just as they are, because rumination in some ways is a very cognitive process. It's in our brains, but I wonder if we allow our bodies to really just feel what it needs to feel for as long as it needs to, then that's one way to process the things that have happened and allow ourselves to let go. And just to give a very small personal example, when I was initially applying for internships as part of my clinical psychology PhD program, I didn't get into the internship that I wanted. And when I got the email with the disappointing news, I could kind of feel that sense of disappointment and sadness, and something that I could imagine myself ruminating over. So instead of that, I actually gave myself a chance to process the disappointment that came with getting that sort of email. So I stood there for like a few minutes, just kind of like allowing myself to feel those emotions and say, that is disappointing, that did suck. And I think that was actually quite helpful for me to be able to let go of it and then move towards my own future. So I also encourage you to think a little bit about some of the things that have been weighing you down and be able to say to yourself, yeah, that did really suck, that was really disappointing, that was really hard, and be able to sit and grieve the things that have happened, process the emotions, and feel maybe a little bit less unstuck as a result of that process. A fourth strategy to find meaning in the crappy things that have happened to us is to honor its impact on who we are today. So I'll tell you a story about one of my patients who was in his early 30s, really successful as part of working as an investment banker, and by all metrics doing really well in life. But one of the things that he was ruminating over was all the years that he has spent early in his life as a student and early in his vocational career focusing just on being successful in this sort of financial sense, because he felt like he had wasted so much of his life now that his values had shifted towards like relationships and hobbies and family, that he didn't want to be working 80 to 100 hours every single week. And if he had known that this would be such a big shift for him, he wouldn't have spent so much of his life, and it felt like he wasted so many of hours when he could have been doing other valued behaviors like spending time with his family and friends and his relationship. So this particular person struggled a lot with rumination because his past self and the values he had back then were so different from his current self, and it felt like he wasted all that time focusing on being financially successful now that his values had shifted. And one helpful reframe that we came up with together was the idea of, would he still be the same person he is today, thinking about all these other values, if he didn't climb up the mountain of success first financially, for him to look at life in a different vantage point? And that was actually super helpful for him to think, yeah, like without that past self doing all this hard work, he wouldn't be the person he is today. And that allowed him to kind of honor both sides and allowed himself to accept what the past offered so that he could be the person he is today. So I also invite you to extend some compassion to yourself and ask the question, what about my behaviors made sense in the moment, given what I knew and what context I was in? Because that helps to reduce our overall sense of shame and reduce the sense of like regretfulness about a life not so well lived. And the reason why this is important is because when we feel a sense of shame, shame makes us want to withdraw. And it's a powerful emotion that is a breeding ground for more rumination to occur. So by reducing shame, we offer up the opportunity to reduce the rumination and get back into the present and feel more hopeful for the future. And since we're on the topic of emotions like depression, anxiety, and shame, one final strategy that I'll offer to you is something called opposite action, otherwise known as opposite to emotion action, where essentially we do the exact opposite of what an emotion is telling us to do, where fear tells us to run away, depression tells us to withdraw and do nothing, shame tells us to hide away. We're actually going to do the opposite of that by getting out of our minds and into our lives. And I don't know about you, but it's a beautiful day in California right now, so I'm going to follow my own sound advice and go outside after I finish up this video.
A few moments later.
Guys, I did it. I'm outside. Anyway, that's all for this one. I hope you enjoyed it. If you did, I encourage you to subscribe because I'll make more videos like this in the future. Otherwise, bye-bye. I've always wanted to do that.